Hi, this is Dr. Zachary Ward back with another case of 10 patients in 10 minutes. Case number 5, talking about a case of chronic pain and inability to rotate her head fully to one side after a head injury. And what's important to note about this case is that all the images that you're going to see here were evaluated by radiologists for what they call pathology or some sort of disease in the bone or an injury to the bone, but they were not evaluated for biomechanical problems. So what you're seeing in front of you is actually a forward rotation of the right second cervical vertebrae. This is the right side of the patient. This is the left side. And there's a large overlap of this C2 coming out underneath the C1 and coming out over the C3. And here's another view of that same patient. Again, this is the right side. We're kind of looking at them from a little bit from the right front, and here you're seeing this gap between the second cervical vertebrae, which is here, and the third cervical vertebrae right here at what we call the uncinate joint. And then you're seeing the forward part of the second cervical vertebrae, the top, coming out underneath this first cervical vertebrae. And of course, here's the back of the skull. So she has a large upper cervical misalignment of the second cervical vertebrae, which is causing her to be unable to fully rotate her head over to the right and causing chronic pain basically for several years after a head injury. So eventually this patient, based on a referral from a friend, finally got a biomechanical evaluation of her neck, was able to get that area of that right upper cervical spine corrected, and now the pain has dramatically subsided, and she now has full use of motion in her neck. I am Dr. Zachary Ward here at Life and Alignment Chiropractic. I am a structural and upper cervical chiropractor in Auburn Hills, Michigan. If you're local to me, you're welcome to ask me any question about this case at 248-598-4002, or you can contact me at laachiro.com/contact. Have a great day.